Hello? Fats?
Wala
Start
pa.
na tayo, Fats. Yun ang ano nga. Sila. Hintayin natin sila.
Yes po, Doc daw.
Tara na. Hello! Good afternoon sa lahat. Good afternoon to everyone. Thank you very much for sharing your afternoon with us. Ako po si Dr. Joan Rifareal, and this is an initiative, a project of the Department of Psychiatry of Veterans Memorial Medical Center for all the members of the staff of Veterans Memorial Medical Center. Kasi alam natin na we are currently facing with a very difficult and challenging time. And ito yung way ng Department of Psychiatry to extend our help, support, and guidance sa lahat po ng employees ng Veterans Memorial Medical Center. Maraming salamat po for dropping by and being with us this afternoon. Kahit mabilis lang, mga 30 minutes lang po of your time. Thank you po. So this is our topic for this afternoon. Coping during this pandemic for us, all the medical frontliners of Veterans Memorial Medical Center. Yes, so this is the outline for this afternoon's presentation. Very short lang po. Let us look at the Philippine situation now among for medical frontliners. Then we will look at the effect of the pandemic on our mental health. Alright, and then the third is what are some of the coping strategies which can help us during this very difficult time. Okay, I hope po clear ang slides from your own homes, from your own offices, kasi alam po natin na talagang these are unusual na situation. So, gamit po natin ngayon ay medyo hindi din siya as pulido, no? So we are making it, we are looking for creative ways para po mapaabot po ang aming tulong ng Department of Psychiatry sa lahat. Okay, let's start. Medical frontliners, the Philippine situation. Alam natin na we are all, so lahat po tayo, no? Lahat tayo, we are facing a very challenging and unprecedented time ngayon. It's very uncertain. Hindi po natin alam what will happen in the next few days, in the next few weeks. Hindi natin alam kung kailan natin, when we can see our office mates, our colleagues again, kung kailan natin makikita ang ating mga family members. And we are all in this together. Lahat po tayo, sabay-sabay. We are all facing this very difficult time now. So yung po tandaan natin na hindi po tayo nag-iisa, we are all in this together. Very challenging, because first time if ever natin in our lifetime na maranasan ito, na naka-ECQ, naka-quarantine, talagang this is unprecedented. First time. And because it is first time, so all can be affected regardless of race, gender, anong qualification. Yes? Sorry po, putol-putol daw po. May nag-message po ata na it's paputol-putol.
No audio daw.
No audio. What's happening? May nag-text, ha?
Wala naman nagsabi. Sabihin mo.
Sorry po, wala daw pong audio. Fats, may audio ba, Fats? Sorry. Fats, can you comment kung may audio?
Wala. Loud and clear naman daw.
Oh, loud and clear. Oh, I'm so sorry. Sorry po. Okay, loud and clear. Okay, thank you po, thank you. Okay, let's go back. So, now let's go to the vulnerable population. In any pandemic, in any emergency, meron po talagang mga vulnerable groups. And who are these? The elderly, which would include our parents, siguro ang ating mga lolos and lolas, persons with other medical problems, pregnant ladies, pregnant moms, of course, kasama sila doon. And very important, number 4, tayo po yon, the health workers. We belong to the vulnerable group. Okay, and sad to say po, no, na now, I hope na na-address naman na to, but we are considered as the irreplaceable link na medyo kulang po ang, medyo siguro, no, nagkukulang sometimes ang help for us, but may mga problems along the way, may mga sources of concerns for us health workers, but hopefully po, slowly naman, we are hopeful and we remain positive na na-address din naman ito ng government. And it's not just here in the Philippines, it's actually happening worldwide. Alright. Who are the medical frontliners? Sino-sino po ba yun? So, every one of us here at Veterans Memorial Medical Center, everyone. So, we are all here to protect and improve the health of our community, of VMMC. So, kasama po dyan ang medical and the non-medical staff who are delivering essential services to our patients and to our community. Alright, but studies have shown that nurses, midwives, and other health workers are at greater risk for COVID-19 than anyone else. And this is shown from this statistic which was published as of May 7. Okay, a total of 1,934 healthcare workers so far were infected. And if you look at this, top 5 healthcare workers, nurses are still number 1. Ang ating pong mga kasamang nurses, physicians, nursing attendants or assistants, medtechs, and the radio technologists. And the rest would include non-medical staff, for example po, no, sa hospital, very important frontliners natin siguro, na, like, siguro it's not reported, but mga social workers, members from the dietary, so marami, no? Maraming pwedeng kasama dito sa non-medical staff. Currently, nag-research po ako, according to Inquirer, the Inquirer report today, this has increased already to 2,300 today. Okay, but we are glad na most of the cases are mild and asymptomatic and may mga severe. But the medyo sad news is that currently we have 34 deaths in the Philippines among our healthcare workers. Meron pang, I think, may news na may nadagdag pa sa numbers na ito, but it has not yet been published yet. So, sa dun pa lang sa na-publish, it's now at 34 deaths in our country. Let's move on. Ano bang effect? Why are we talking about this now? What is the effect on us? It is important to know that from studies, from evidence, working in the front lines was an independent risk factor for worse mental health outcomes, okay, in all dimensions of interest. So this is really sad, and it's really a concern to us kasi we are in the front lines. From the study published in Lancet during the SARS-1 outbreak in 2002, 2003, studies have shown that there was an increase in suicide rates among healthcare workers who experienced emotional distress. There were suicides among those 65 years old and older, and among those who recovered, 50% remained anxious, so there were symptoms of anxiety and emotional distress. Siyempre, there are several factors for this, and there is so much pressure among us, among those in the front lines, and the task of during this pandemic can really be overwhelming. Now, currently, with this COVID-19, there are 2 studies done in China. I mean, tatlo, that studies done in China. First is they studied the general population, 1,210 respondents, and studies have shown that there were depressive symptoms anxiety symptoms and symptoms related to stress and distress. Okay? Another study, again, done in China, but this one, ang population study nila were among the medical staff treating patients with COVID. And what did they found out? No? They found out that anxiety positively correlated with stress. So there was increase in stress reactions among the medical staff. Lastly, another study. This again was published by JAMA. Okay, it involved 1,257 healthcare workers, again in China, and mataas, 50%, more than 50% had symptoms of depression, insomnia, which can be a symptom across different mental health disorders, okay, anxiety and distress. I hope that we can do similar studies in the Philippines later on, or maybe probably in veterans, if we can do this. Okay, therefore, these studies have shown that in fact talagang these are challenging times. It really is a challenging situation because aside from the burnout of our staff, there is this effect. No? This is a new wound which has a stabbing effect. No? It's a fresh wound which has a stabbing effect. Nagdagdag ng pain. Nagdagdag po sa atin ng pain and distress, no? During this difficult and challenging situation. And very important po, nagkakaroon ng lately, may mga na first wave, second wave. What's important? Let's watch out. No? Now they say it has been predicted that there is this fourth wave which would include psychiatric trauma, symptoms of trauma, mental illnesses, PTSD, economic injury, kasi lalo na ngayon, we do not know kung pagbalik ba natin, may mga trabaho pa rin ba ang iba sa atin, burnout and others. So we need to promote our mental health to be able to prevent any major psychiatric or mental health problems later on. So let's go to mental health promotion. Sorry po. Okay, so ano ba, no? So ano ba ang nagko-cause? What are the sources of stress among us? And of course, you can add, kung meron pong gustong mag-add, no, ng sources of stress, you can in fact comment doon sa chat box kung if there are things na which have not been which are not included na in my list. Okay, first, may takot po about infection. There is that risk of infection, which is a direct threat to us. No? Siyempre, we are in direct contact with the patients. So, number one po talaga, ang fear natin is we get infected. And at the same time, we spread the virus to our family and to our loved ones when we go home. Ano pa po? Number two, okay? Helplessness. There is that sense of helplessness, especially nung unang mga days siguro following the outbreak, the pandemic, of lack of access to PPEs, equipments, and I think this is not just here in the Philippines, but naging problem ito globally, worldwide. We heard of news that talagang it is also affecting, this same concern is also affecting other countries worldwide. Losing high volume of patients. We feel helpless kasi kahit na we give them the best care, talagang we sometimes talaga umaabot sa point na we lose them during our care. Okay, due to lack of resources. What else? Moral injury. This term, in fact, originated from the military, to describe psychological distress from perceived injustices in government, etc. But now, we apply this as an injury. It's a difficulty which affects our mood, nakakalungkot, when we have to make decisions, triage decisions. We are forced to come up with decisions, to make medical choices because our patients are separated from their families. So normally we involve the families in the decision making, but due to the the status that they have to be isolated, sometimes ang doctors na and the staff would have to decide, no? What is, ano na, no? The decision lies with the staff on what to do with the outcome, no, of our patients. Next, ito din, ha, it's really a concern, no? Especially with self-quarantine. Yung iba sa atin nagsa-self-quarantine and because of too much workload, hindi nakaka-uwi, work schedules, hindi nakaka-uwi sa mga bahay. There is a sense of lack of social support from our family and friends and social isolation. We become isolated from our family, from our friends. And studies have shown what is the effect of social isolation and loneliness. Now, kasi when we are isolated, we feel lonely. What is the effect of that? Studies have shown that they are strongly associated with anxiety, depression, self-harm, and suicide attempts across the lifespan. So wala siyang pinipiling age. Na? So, when we feel lonely and isolated, we are at an increased risk to develop all of these mental health concerns. Another stressor is trauma. Na? We call it secondary traumatic stress. Ito siya, it's an indirect source of stress. It's an indirect, parang we are indirect victims, na? Because which results from exposure to another individual's traumatic experiences. So when we tend to them, nakikita natin kung ano yung mga complications na our patients suffer or go through, then we also feel traumatized by that. So we become the indirect victims. Okay, so secondary traumatic stress. Okay, other stressors, stigma, which is really sad kasi it's happening. Like stigma, pag nalaman na ang isang tao is a healthcare worker, parang ina-avoid tayo. Did you experience that? Parang ina-avoid tayo, walang gustong, walang, yun nga, no? Parang it affects how they perceive us kasi ano tayo, no? Because we are exposed, so there's the thinking that we should be avoided. Na-experience ko yan sa elevator. Walang gustong sumakay sa akin sa elevator. Okay? Also, pag nalaman ng family natin, sometimes, no? Parang iba din, no? We are given our own separate room. Iba ang nila, no? Iba ang gamit sa atin na plato or utensils. Okay? So, I've heard of stories like that. So, there's that stigma in the community. Another is strict biosecurity measures, physical strain of PPE. Grabe, no? Wearing PPEs for straight 12 hours. Kasi nga, hirap if we remove it and then kung magbabanyo, it's so difficult kasi there would be that risk of contamination. So, at matagal, no? Hirap umihi, hindi tayo makakaihi. So, it's very hot, di ba? When we wear our PPE, it's very hot. So, talagang it can be an added risk. Alright. Physical isolation again. Kasi, lalo na pag naka-PPE tayo, then we cannot just go to the clean ward. Talagang iiwan tayo doon sa COVID wards, or sa medyo not so clean wards. Ito, it's very common. It's also a source of stress. Increased demands, higher demands in our work setting, including longer working hours, longer shifts. We have more patients to attend to, and there's a need to be updated with best practices about COVID-19. And also, sometimes we lack information, the effects of this on yung mga updates. Sometimes it can also add to stress. Like ngayon, may mga info and unverified pa. Parang ngayon naman, ang target are the pediatric age group, although we do not know so much pa about this, if it's really due to COVID. So, ito din, it sometimes can add to our stress. Alright. So, what can we do? Again, as veterans, as one community, it's important that we work together. We work hand in hand. Why? From this, here, mental health and psychosocial support is a component of any public health response. So it's not enough na we tend to the physical needs of our patients, but of course, we also need to look after ourselves kasi we need to be healthy in order to be at our best, not our most functional state to be able to take care of our patients. In fact, in any disaster response, in any disaster work, public health concerns, always talaga, it's integrated. Mental health and psychosocial response is always integrated. So, kaya we are really pushing for this, na isama talaga ang mental health and psychosocial response. So, if we can see from this pyramid, now this is a pyramid for mental health and psychosocial support for us, for our patients, we can see na lahat tayo, from the admin down to everyone, to all members of the staff, we have specific roles according to the levels of support na which we need to give as one community. First, ensure basic services like safety and security and provision of the basic needs. So, diba? So, dito papasok po ang mga members ng dietary natin to ensure na we have food for all of the members of the staff. Security services, kasama yon. Then, down to the admin, okay, support from the admin, nursing supervisors, etc. Down to specialized services, which would include na this from the Department of Psychiatry. Kaya very important po na we need to highlight na lahat tayo talaga we have important roles towards maintaining and promoting a positive and healthy mindset among the members of the staff of Veterans Memorial Medical Center. Key points. So key points na lang po para it's very quick lang. Key points for frontliners and management. Let's start with action points for institution for Veterans Memorial Medical Center in general. So, ensure pre-deployment preparation for new staff, okay? And ongoing training for existing members of the staff like us. Now, ongoing dapat talaga siya. Like stress management. Remember po ninyo kung sino pong naka-attend na before, we had series na of talks on stress management. It should be ongoing, lalo na ngayon na we are really facing a difficult time and a challenging situation. Okay? Activate peer support systems. So, that's why the Department of Psychiatry came up with this peer support group. Okay? It's a platform para we can of course support each other during this difficult time. So this is for the institution, VMMC in general. Number 2, health facilities authorities, so admin. This will include the admin. For the admins, make sure that we are all provided with proper PPE. Okay, dati ito siya, but now we have new guidelines, and I think na present na to sa atin before during our meeting with Dr. Chong. Okay, so yung proper PPE, donning and doffing, it has been explained by the IDS team. Okay, so, and other public health measures to ensure the safety of all the members of the staff. Ano ba yung other public health or safety measures? Like, infection control. So, like ngayon, so tamang-tama yun sa harap natin pagpasok ng lobby, we have temperature scans, alcohol is provided, so which is very good, kasama yun sa infection control. We are provided with masks, alright? And of course, sana, if we need, or there's a need to increase staffing, so more medical staff, especially kung talagang dumadami po yung ating patients. Now, let's go to managers, supervisors, department heads. Ano po ba ang role nila? Nursing supervisors. Alright, so dito po kayo papasok. Supervisors, leads or leaders of the departments, managers. You all play a crucial role, okay, in protecting the mental health of those under your care. Alright. So make sure na you encourage your staff na kailangan, if they need to seek help, please talk to them, encourage them, sana po there is training. It's important na the leaders know how to talk then about mental health and encourage the members of their staff to seek help now whenever it's necessary. Practical tips for the managers, the leaders, the department heads of veterans. Okay, provide regular meetings with your staff, with your groups, okay, to discuss challenging situations and dilemmas. For example, anong gagawin kung ganito? What are the options available pag ganito ang naging concern? So sana there is a regular meeting. And activate a buddy system. Buddy system is very important para we continue to look out, no? Monitor each other, look out for each other, and sana kailangan talaga to, no? Pag may napansin tayo sa ating body na parang medyo nagkakaroon na ng functional impairment, functional decline, then we can help each other and sana refer, okay, to us. Organize work schedules to include breaks between shifts. Ngayon, I think nagkakaroon tayo ng these breaks, skeletal workforce, which is to encourage to lessen the exposure natin sa hospital. So this is very good. And minimize other work-related risks to stress. Okay? In collaboration with occupational health or with us, with our department. Please, leaders, mga boss ng mga departments, proactively identify members of your staff who are or who might be suffering. Pag napansin nyo po, no, na parang hindi na masyadong nakaka-function properly, nagkakaroon na ng difficulty in terms of productivity sa trabaho, nagkakaroon na ng symptoms of depression, anxiety, stress, na overwhelmed na sa kanilang mga tasks, please, it's important to identify, to monitor po, and provide relevant support. In fact, kasama yun sa triangle ng pyramid kanina, dun papasok po kayo, dun sa second, no? Providing support to the members of your staff, members of your department. Very important, as mentioned kanina, stigma. Let us fight the stigma. Let us fight the stigma na kasi if we, di ba, if we discriminate no ating mga colleagues sa ating department, wala naman ako nababalitaan at may mga from other news na naririnig natin. The tendency is itong staff member will not seek help anymore. Kasi nga, if there is that stigma associated with being, halimbawa lang, with being infected or having symptoms or any form of stigma, it will prevent that person kasi from seeking help. So, mas nagiging challenging palalo ang situation. So, let us stop the stigma. Now, let's move on to us, yung mga healthcare workers. It's important to manage our mental health, emotional well-being, and psychosocial health. It's important. So, there is no health without mental health, diba? That is from the WHO. Let us use helpful coping strategies. Ano ba yung mga helpful or positive coping strategies? Like, very good, yoga, stretching, physical activity is very important kasi it helps boost our immune system. It boosts the level of endorphins, the happy hormones. Okay, eat nutritious foods, get enough rest, sleep properly, sleep well. Important is the quality of sleep na sana when you wake up, you feel rested. Okay, and exercise. Any form of physical activity is very important. Kahit na walking, in fact, malayo na yun. Yung walking natin from the gate to our own wards, di ba? Malayo na yun, but that is also very good. As much as possible, we get enough exercise or physical activity. Avoid using medyo unhealthy coping mechanisms or coping strategies like alcohol. Buti na lang naka-liquor ban. Hindi, joke lang. But, kasi in the long run, alcohol is it's a natural depressant, okay? It's a natural depressant, no? So, in the long run, it can worsen our mental and physical well-being. Okay, so let's avoid all of those, medyo unhealthy. Very important. Ako talaga, I emphasize this, not just to healthcare workers, but to those under my care. Okay? Let us love ourselves. Let us be compassionate with ourselves. It's okay. Okay? It's okay not to be okay during this time. Walang right or wrong feelings and emotions during this time. Wala, no? We are entitled to feel sad, to feel worried, to feel anxious. Again, these are normal reactions to an abnormal time, an abnormal situation. Alright, so be compassionate with ourselves. It's alright to feel everything, okay? And it doesn't mean that we are weak. If we feel sad, if we feel lonely, if we feel distressed. No. Okay, it's normal. It's okay to not be okay during this time. Acknowledge our feelings and let us not be guilty about them. Again, these are normal reactions to an abnormal situation. Next, maintain social connectedness. Okay? So with the ngayon, di ba? The physical distancing now. It doesn't mean na we also become socially distant. So let's maintain that social connectedness through dropping a line or two to our family members na hindi natin nakakasama sa ngayon. Kamustahan. So may mga avenues ngayon for kamustahan from different platforms like Messenger, Viber, Zoom. Marami ng platforms ngayon. Let's maintain that social contact despite the physical distance. And provide care and support to those na pwedeng na-quarantine or na-stranded. May mga patients under my care na stranded, hindi nakaka-uwi to their So let's kung may mga ganun din tayong friends, let us make sure na nakakamusta natin sila and let them know na we are here to support them during this time. Allow time for you and your family to recover. Okay, ito now it's not a contest. Yun pala, yun ang gusto mong sabihin. Allow yourself to recover. Okay, kung wala kayong duty, kung nasa bahay tayo during our breaks, this is not naman the time na contest tayo, no? Padamihan tayo ng magagawa, no? Padamihan tayo ng nagagawang painting, nagagawang crochet. No, take your time. If you feel na you need to sleep ngayon, yeah, then sleep. No, use the time to sleep, recuperate, recover. Just allow yourself. No, hindi siya contest. Hindi to padamihan ng nagagawa at this point. Self-care activities, bonding with your family. No, kasi ngayon na walang pasok ang ating mga kids. Then, let's use this time to play with them, bond with them, nood tayo ng TV together, watch movies together, alright, as a form of de-stressing. Schedule a limited time to listen to news and social media. Yes, kasi too much exposure to news and social media can also be very overwhelming. Nakaka-overwhelm when we are bombarded by all of these statistics, this news. So, it's recommended na we just limit it. No? Siguro check tayo what is the latest update in the morning. Then choose again. Check again at night, no? Bago tayo matulog. That's it. Because so much information overload can ruin our productivity and increase anxiety. Next. Okay, fake news. Again, this is a concern about social media. Fake news is spreading faster than the virus, diba? Let's think before we click. Let us be discerning. Ako, personally, I suggest getting reliable info from the WHO website and DOH website. And let us only share kung talagang verified ang news and information. And kung hindi naman siya verified, please let us avoid clicking it or sharing it. Kasi we need to be vigilant then and mindful kung ano yung mga sinishare natin in social media. Remember that during this time when we feel stressed, anxious, sometimes our heightened emotions can have an impact towards how we interact with our family members, with our colleagues sa trabaho. Why? Kasi when we are emotional, sometimes we say things na hirap nang bawiin, and we tend to do things na without really thinking so much about it, na nasisira ang ating, nawawala ang ating logical part of the brain, and judgment can be impaired when we become too emotional. Okay, so it's important that we keep our emotions in check to avoid conflicts. Alright? And para maiwasan natin na we say things or do things na hindi na natin kayang ibalik, no? Or bawiin. Sometimes, too much anxiety can be paralyzing, no? So, ang always, please, let us accept, learn to accept na during this time talaga, we have no control over some things, no? Like kung kailan tayo babalik, kung kailan tatanggalin ng ECQ, GCQ, etc. We have no control over those. But what's important is that we focus, okay, on the things or events that are within our control. Kasi may mga bagay naman na tayo, we have control over. Like what? Ano ba yon? Like gratitude. We can practice gratitude for the things na which are still under our control. Maganda to, no? An activity, if we can list down 5 things na we are grateful for. Like, for example, pagising, no? We are happy, grateful na, yes, we have access, unlimited access to oxygen, diba? From the environment. Wala tayo sa, hindi tayo naka-respirators. Yun talaga, yun ang lagi kong, that's really what I'm grateful for every day, na? Unlimited supply of oxygen. We are healthy. We have work. We have our family. So, talagang yun, no? Yun ang may control tayo. Gratitude is very important para we remain positive. We remain focused sa mga positive and blessings natin. Take time for personal interests and hobbies. Okay? During this time of ECQ, kung wala tayong work, kung naka-skeletal tayo, then maganda, no? Na we do our things na which can make us feel happy. We learn things. For example, this is the time yung iba, na they will learn anong tawag dito? Drawing, painting. Ito yung time na nag-learn sila to tawag yun, you sew, yun, itatahi sila, come up with new clothes, dresses. Maraming pwede pong gawin, no? So, this is the time to do that. Next, laughter is still the best medicine. Okay? Please, huwag kalimutan tumawa. Kung talagang nakakatawa, tawa lang, tawa. Huwag pigilan. Pag natatawa tayo, huwag pigilan. Okay? Laughing, no? Ha, ha, ha. Decreases pain. Kasi it releases endorphins. You know, yung endorphins po, di ba? It's, yung endorphins, di ba? Diyan nanggagaling yung, you know that? Yung pag-pain, ano nga yung binibigay? Yung morphine, di ba? Morphine, okay? So, parang ganun siya, no? So, it releases endorphins, which are good to relieve or decrease pain. So, tawa tayo. Promote muscle relaxation, lessen the wrinkles, and reduce anxiety. Okay? It boosts ka rin, the endorphins. It feels good. So, tawa na. Ngayon, tawang-tawa ako sa mga anak ko, personally lang, kasi nagti-TikTok sila. Talagang natutuwa ako pag nakikita ko silang tumatawa, kumaganda. So, laughing, ha. Laughter is the best medicine. Take care of spiritual needs. Malapit na po matapos. Take care of spiritual needs. Spiritual needs, it doesn't mean religion. No. It means finding that purpose in our life sa mga nangyayari sa panahon na to. So, like, it can be, no? Like, if we reflect on it, baka ang meaning nito is, it's a way of taking care, no, of our Mother Earth. Kasi gumaganda ang pollution. Bumababa ang levels of pollution. We are now able to see the skyline clearly. Blue ang waters ng Manila Bay. So, baka yun yung mga, the meaning of everything that's happening now. And, if you can, take time to meditate kung kaya. There are apps available from our phones to help us calm ourselves, release anxiety. Okay, may mga meditation apps sa phone. it can be helpful to bring down our levels of stress and anxiety. Deep breathing exercises are very important. This is evidence-based. Studies have shown na when we do deep breathing exercises, bumababa ang level din ng stress hormones natin, like cholesterol. That's why when we do it, deep, inhale slowly, 4 counts through the nose, pause to allow the exchange of gases, and then exhale, 4 counts then. It helps lower the level of stress hormones called cortisol, which would later on, ang effect niya is to lower our heart rate, respiratory rate, lower our BP. So it's very important. You can repeat this, do this 10 times. And visualization, you can visualize kung talagang stressful. You can remember kung ano ba yung mga events or places na nakakapagpakalma sa inyo visually. Visualize in your brain. Lastly, please don't forget that when we feel the need na kailangan natin kumausap, we need someone to talk to, please remember that help is available. These are the hotlines available. But of course, ito siya in general na hotlines, NCMH, etc. Of course, PPA also has a hotline. Asan ang PPA? Here, Philippine Psychiatric Association, that is our group. But of course, in VMMC, we have our VMMC support group. And I'm happy na marami sa atin ang members na dito sa support group. And I hope we can still invite yung mga kasama natin sa department natin na hindi pa members. Please invite them to join our group. Kasi we will be posting mga updates there, messages of support and encouragement during this difficult time. Alright, so we are all essential in our jobs. Let's remember, no, we are not alone. You are not alone. We are not alone. We are all in this together. Kaya important na we work together, hand in hand, avoid conflicts as much as possible. We follow the triangle and the pyramid kanina, which reminds us na each one of us really has its own function, a very important function towards the overall productivity and towards the overall growth of VMMC, okay? Especially during this difficult time. Alright, and with that, I would like to thank everyone. Medyo nag-extend tayo sa 30 minutes. Superheroes wear masks too, that is us. Okay, let's all wear our masks. And again, thank you very much for participating in this afternoon's talk. And I hope na maalala natin po yung mga positive ways of helping ourselves in order to maintain that positive and healthy well-being during this time. Bye-bye! Thank you po! Hindi ko na po alam kung may mga question kasi nakaharap ako. May mga question?
Wala pa naman.
Walang question. Okay, so if there are no questions, Fats, may question ba, Fats?
Wala.
Okay, so with that, maraming salamat po and see you soon when everything is better. Sama-sama tayo ulit lahat sa veterans. Bye! Thank you!